Hello, I'm Christine, and for my caregiver interview, I'm interviewing my friend Bob, who is currently caring for his elderly mother. Thank you so much for your time, Bob.
You're welcome.
If you please give me a brief background on the person that you care for and the other people who jointly care for this person.
Right now I'm taking its primary care for my mother. My mother is 84 years old. She lives outside of the Philadelphia area where actually I grew up. I'm one of three children, but from a proximity standpoint, when it comes to taking care of my mother, I happen to be the closest.
Okay. So you would consider yourself the primary caregiver?
Yes, I would.
Okay. And what role does that entail as opposed to the other people who also care for your mother?
Primarily, I guess, although proximity, there's as far as a support role, just talking with my mother, keeping in touch with her, making sure that she's doing all the things that she's supposed to be doing, such as her finances and getting out and about.
Okay. Do you think what is the most challenging aspect of taking care of your mother?
I think the challenge is not just from a proximity standpoint, but just keeping her spirits up, just making sure that she's doing everything that she's supposed to be doing, whether it's taking her medicine, making doctor's appointments, or just getting out in general.
Okay. And you had mentioned keeping her spirits up. What do you do to keep her spirits up, and how do you think that is pertinent to her well-being?
Being probably consistent with the contact, speaking with my mother on a daily basis, just getting her into that routine, just talking about the everyday things, or talking about the past, growing up, and some of the things that she enjoyed over the years.
Okay. What do you feel would make your job easier?
Well, I guess obviously proximity would be the major help as far as being able to live locally.
Mm-hmm.
But for now, that's not something that's going to happen. As far as being just a lot easier, would probably help if I had somebody, a family member closer to her, or just had somebody that I could contact in case of emergencies, or if she I need to get to her quickly, or she needs help quickly. So probably it's all going to come down to proximity is going to make it a lot easier.
Okay. So if you had somebody closer, it would really make your job easier.
Yeah, definitely.
Okay. What challenges do you foresee coming, anytime down the line, and are you doing anything to prepare for these future challenges?
I guess from a challenge, or some of the work concerns that I have for the future is we have made arrangements, or she has an opportunity currently to go to a very nice retirement community. However, from trying to talk her into that is a little bit of a challenge, because she doesn't want to give up that independence.
Mm-hmm.
But one of my biggest concerns is when it becomes availability at this particular retirement community. Obviously, it's a lot easier for them to go in when they're still independent,
Mm-hmm.
instead of dependent care, because from a timing standpoint, that's normally what takes the longest. And I know my brother and I have a concern that she, if we continue not to push the issue, we might end up having to face that challenge.
Okay. So that sounds like something that really is going to be a bit of a hurdle coming down the line.
Correct.
Okay. And do you feel that's your largest problem that you think you're going to have to face, or one of the largest?
Yeah, I mean, you talk to her, she changes her mind, as most people do, where she thinks she's ready to move into a retirement community, but that decision doesn't last long, and,
Mm-hmm.
and again, it's my concern that something happens to her health-wise, in which, there's not going to be availability and we're not going to be able to get her where we need to get her.
Okay. Well, thank you so much for your time. Our time is up, and I do appreciate you doing this video with me. Thank you.
You're welcome.